that will be chaired by the African Union Commission to make sure that we have a common understanding allocation. And I'm working on that meeting, and we'll brief you as we move forward. The third financing stream is through the Afri-Exim Bank. I indicated here a few weeks ago that Afri-Exim Bank is ready to raise up to $5 billion on condition that all member states come together and work through their special drawing rights to extract about or raise about 1.8 billion. If they raise 1.8 billion through their special drawing rights, then the Afri-Exim Bank up to about 5 billion. So they have three different streams that are very complementary, and that is the way it should be. I mean, we should have the latitude and depth of approaching the acquisition of vaccines in any dimension. The key is to have reliable vaccines, which we always rely on the WHO's pre-qualification. The key is to have timely access. The key is to make sure that people who are in need have the vaccines in a timely fashion.
All right. Thank you very much for that. The next question I'll pass on to Ahmed. And this one is coming from Joe Forster. And Joe is with the German press agency. And the question is, what preparations have African countries like Kenya made for the rollout of a COVID-19 vaccine? What are you hearing from the ground in Kenya?
Thank you very much for that question. This came up during conversation that I've had with the Honorable Minister. And two things that the Kenyan government is preparing. One is mobilizing resources to be able to purchase the vaccines when they become available. I think Dr. John has explained quite well how our efforts to make sure that Africa gets its equitable share. So that financing bit is one thing that they're doing in preparation. And second is the need for vaccination, actually getting the vaccine to where the population will get it. So there is a lot of assessment of what infrastructure do they have to be able to get the vaccines from the point of manufacture to the point of vaccination. What do they need to be able to do the vaccination, and what kind of capacity building is required to ensure that vaccination is being done effectively, including the tools for documenting those who have gotten, those who have not gotten, those who need to have a repeat dose. So this kind of preparations is what is very key, and that's what the Kenyan government has shared that they are doing. Indeed, it is what all other governments will be preoccupied with as we get into the phase of vaccines becoming available. Thank you.
I'll stay with you, Ahmed. This question is coming from Sarah Jerving with DevEx. And Sarah says, what do you think about the efficacy results from Russia's Sputnik 5 vaccine? Are there any countries in Africa negotiating with Russia to supply them with vaccines from Russia? And finally, has the Africa CDC been in discussions with Russia about its vaccine?
Thank you, Sarah, for that question. I'll start with the last one. Indeed, yes, we have been discussing with Russia to try and understand their vaccine, to try and see what their data contains, and also to engage with them for vaccine trials to be happening on the African continent as well. So we have been engaging with them, and we will continue to assess the Sputnik 5 vaccine. In as far as which countries are engaging with Russia directly, as Africa CDC, our preference is that we go into this as a continent, because then we have a better plan for the whole continent rather than individual countries. Therefore, what we are discussing with the Russians is what we're sharing with our member states. In as far as efficacy is concerned, we are studying the data that they are providing, and we'll also be studying the clinical trials data that we will be doing here on the continent if we reach that kind of agreement with the Russians. Our preoccupation are two. One is a vaccine that is safe and a vaccine that actually is effective in protecting the public. And all vaccines will be approaching from this perspective. Thank you.
Thank you. Let me come back to John, and we are now taking questions from our Q&A section on this platform. So this first question is coming from Maxi Eckert, and Maxi is with the Standard newspaper in Belgium. And the question is, could you say something about the situation in the hospitals? Are health case facilities overwhelmed in some countries? And is there a fear that they will be overwhelmed in this second wave? So those are two questions from Maxi from Belgium.
Thank you. Those are very good questions. For one thing, to address the first question is no, we are not seeing hospitals being overwhelmed with COVID patients. That is clearly what our situation is. We are very encouraged that during the first wave, we didn't see that kind of overwhelming, which we were very, very worried and concerned with. That doesn't tell us that the second wave, that scenario will not happen. It only tells us that we have to prepare for and prepare using the 3 T's, which is the test, the trace, and the treat. Have case management facilities that are ready in case we have a need to hospitalize our patients more than we did in the first case. As we speak, we have a team that is running around the continent now. They are in Burundi, working with the government of Burundi to help them in case management, preparedness for any eventualities. And they will be going to Equatorial Guinea and to Gambia subsequently. So I think we are really taking this second phase wave potential very, very seriously, as we did for the first case. But we are not seeing a large number of hospitals or hospitals being overwhelmed by a large number of COVID patients.
Thank you. I will stay with you. The next question is coming from MacDonald Zirutwe, and he is with the Reuters News in Zimbabwe. Does Africa CDC have, at this point, any idea which vaccine or vaccines could best work in Africa? And also, when can countries expect their first doses, given the lingering concerns about access?
So what we should, 2 things we should really think of. One is that vaccination will perhaps not start in Africa until maybe the second quarter of next year, and given all the logistics, I mean, that we know of. I think that is clear. We are using that. We should use that space wisely. That is, use that space to prepare, put the appropriate delivery systems in place. Use that space to prioritize which vaccines we believe will be suitable for Africa. And then use that space also to continue to encourage manufacturers and our bilateral partners to actually do vaccine trials and testing on the continent. I think it's very important. Why is testing on the continent of those candidate vaccines important? I think it clearly will, vaccines are based on immunologic reaction. We truly cannot assume that what has worked well in developed world will work in Africa at the same level. And I mean, we have different comorbidities, different genetics, and we should really make sure that we encourage our partners to work with us, Africa CDC, to do those testings as well in Africa. We are not saying that they have to be done before we start using the vaccines that have been proved to work, but at least we're saying that that is required. Remember, there will be a need for us to do a phase 4 trial. A phase 4 trial it will be a scenario where it tells us for how long the vaccines will protect us. Okay, would it be a flu-like vaccine where you do that every year, or a vaccine like measles or yellow fever that provides immunity for a very long period of time? So the earlier we start working together with companies and other bilateral, the better for everybody, so that we really understand how these vaccines will work. So the short answer to that is that we don't expect the first quarter, that is between January and March or April, that we'll get vaccination on the continent. That is clear. We really have to be sure that we also stay on message with respect to the public health measures. We cannot let down our guards with respect to the public health interventions that we have been discussing on this platform. That is the mask, the social distancing, the community engagement and washing of hands. Then because we heard that the vaccines are available there, then it will be a catastrophe for all of us. I think even when vaccines become available, it will take time to vaccinate the appropriate number of people. So that means that we need to continue to work hand in hand, use the vaccine, the biomedical intervention, as well as the public health measure. And lastly is building trust. The time for all of us to get committed in this process is to communicate effectively with the community. We are very concerned that the anti-vaccine movement will become a handicap for when the vaccines are truly available. I'm already seeing on social media things that people are circulating, which is really not accurate. Vaccines are safe. We know that vaccines. We've all personally have had to been immunized by more than 8 different vaccines from my childhood to present, and I think nearly everyone in Africa has survived because of vaccines that have been available since we were childhood. I say this because the narrative that we build around the COVID-19 vaccines may not just impact COVID, they may have consequences on other vaccines. And I think that would be a catastrophe, a public health catastrophe, if we allow this anti-vaccine movement to take hold. So we have to rely on trusted information. That is, if you need information, accurate information on vaccines, you go to the Africa CDC website or the World Health Organization website to get that information, or you call out. We also ask that the media continue to focus on the safetiness of these vaccines, the trust that public health experts and scientists like us are bringing to the conversation.
Thank you very much. Let's join our colleague Peter Fabricius, who wants to ask a question live. Peter, good morning.
Good morning, Wim. Good morning to you also, Dr. Ngasong. Good job you're doing. Can I just ask you, similar to the question that was asked about the Russian vaccine, the Chinese have also, like at the BRICS summit last week, offered their vaccines, I think also plural vaccines, to BRICS countries, and they've also offered them to Africa. So I just wanted to ask you where you stand as the Africa CDC in terms of, and similar to the Russian one, assessing the safety and efficacy of the Chinese vaccines, and have you sort of yet calculated them in your overall strategy? And my second question is, what if you can? I know it's probably very complex epidemiology, but how you can very briefly explain to a layperson why 60% vaccines equals herd immunity. Thank you.
So let me start with the first question. We are in discussions with the Chinese as well, as Dr. Umar indicated earlier. We are in discussion with any party. We are actively encouraging all vaccine manufacturers to talk to us. We have a platform that we established a few months ago, actually in July, called CONVAC, which is the consortium for COVID vaccine trials. And that platform has been on, is a steering group that is chaired by Professor Slim Karim from South Africa and Professor Sambaso from Mali, who are really respected vaccinologists, researchers, and public health experts. I think, and the goal of that working group, which is the pillar one of our 3-pillar strategy for vaccine strategy, is to engage with the manufacturers. And we have been talking to Sanofi, to Johnson & Johnson, the Chinese, and the Russians, and all. So as we speak, we are formally engaged with the Chinese group doing work in Morocco and Egypt. as you may know or not, the Chinese are doing or plan to do vaccine trials in those two countries in North Africa because of the epidemiology. So we've written to them and to ask that we sit down and discuss so that we are in the knowing of what is being done and we can advocate for it. We can help in the coordination of that as the Africa CDC, which is a specialized technical institution of the African Union. So we are we've also been discussing with Johnson & Johnson. Clearly, just this week, we had a big conversation, a long conversation with Johnson & Johnson. So we are really talking to all the parties. So in the spirit of our strategic, our joint continental strategy, which speaks to 4 C's. They need to cooperate, to coordinate, to collaborate, and to communicate. So I think and report back to the leadership of the continent, which is the Bureau of the Head of States, chaired by President Ramaphosa. So I think that is what that is how I respond to that first question. With respect to the 60% herd immunity, there's clearly a formula. I mean, this is not just some numbers pulled from mid-air. If you read the recent Lancet paper that was published this week by Anderson Roy, who is one of the respected experts in this field. I mean, there's a simple formula which says 1 - 1 divided by RO will give you and factor in some equations will give you the herd immunity, which the RO means the rate of reproduction of the virus. Now, if you look at how herd immunity is determined. Normally, based on the contagiousness of the virus, herd immunity is only achieved if you vaccinate between about 50% of the population to 90%. So the more contagious the virus is, the more people you need to vaccinate so that you can create that barrier for the virus to stop circulating in the population. And for measles, for example, you need to vaccinate up to about 90% of the population because it's a very contagious virus. We have seen now, if you apply that to the COVID-19, you see how quickly COVID is spreading. I mean, within 10 months, we are now at about 60 million cases across the world. I mean, it took us 40 years to get 80 million people infected with HIV, and it has taken us only 10 months or 11 months for 60 million people to be infected with the COVID-19. So it's a highly transmittable virus. So if you look at that, and the second thing that you look at in terms of achieving your herd immunity is the efficacy of the vaccine. So if your vaccine is 90 to 95% effective, and then the RO, which is the rate of reproduction of the virus, is less than 2, then you can actually plug these numbers into a formula, and it will give you the 60%. Actually, if you use the 95% efficacy that we saw this week for two of the vaccines, in our context, it actually puts us at 66%. So we are actually lowering, we should be saying 66% based on what we now know, based on the efficacy of the vaccines, and then based on the RO at that level. But we stated that we'll strive to get to 60% in the spirit of letting us that we should not fail in trying than fail to try. So I think that is how we get to, Patrice, how we get to that 60%. I mean, as you recall, other countries in Europe, I mean, Britain, I think they are striving at 70 to 80%. The United States is striving at similar rate. Indonesia is striving at 60% or more, and many countries are around that level.
All right, so let's put the next question to Ahmed, and this one is coming from Linda Nordling, and Linda is a freelance journalist, and she says, do you think there will be a need in any African country to reimpose lockdowns or movement restrictions in the continent's second wave, like we are seeing in Europe? And if not, why not? So that's from Linda Nordling.
Thank you, Linda. The decision about going into lockdown is guided by the numbers and the intensity of transmission of the virus at country level. And those guidances we have shared with countries, And if the transmission hits those levels, then a country will then be justified to be able to go into lockdown. But we cannot at this stage determine if a country will go into lockdown or not, because we have given guidance on the parameters they should be looking at to be able to decide whether they need to go into lockdown or not. I think where Africa has reached is very commendable. The numbers have been kept relatively lower than what was expected. And this experience has strengthened governments to appreciate how well public health measures work when they are implemented effectively. And if countries continue to implement them effectively, they can be able to avoid another countrywide lockdown than like what we saw earlier in the pandemic.
All right, thank you.
Let me just compliment that. It should be very clear that we are better prepared today than for the second wave than we were for the first wave. If you all recall, in January we were scrambling to look for PPEs, that is personal protective equipment. In January, if a country had 1,000 tests, it was considered a goal. Today we have large number of tests available, the antigen tests are available. So we are much more prepared to deal with this second phase than we were. Now, the key is that you have to intensify surveillance. There is ability to trace where these local outbreaks will occur, or the so-called hotspots, and be able to move your team there rapidly to do the isolation as much as possible. As I indicated earlier, the good news is, in the spirit of being more prepared than we were 10 months ago, is that we have an antigen test, okay, which is will give you the same results like the PCR test, and you take less amount of time to do it, and you can actually start acting on the case identification and isolation quickly. So we are very, as Ahmed said, we should really be organized, get ourselves more organized into rapid response teams locally, so that you can attack those hotspots that will emerge quickly, like schools. Okay, our schools are now open. When you have we encourage that you do regular school testing, and then using the antigen test to maintain the schools open. Businesses, so that you're ahead of you test and you're ahead of the curve than being surprised by local outbreaks that have really infected many people in the community.
Okay, let me stay with you for the next question from Kara Anna, and Kara is from Associated Press. And she says, Ethiopia's prime minister says the military has been ordered to move on the Tigray regional capital. And the United Nations says the entire region cannot receive aid. What could this mean for the spread of COVID-19 in that region?
So, Kara, thanks for that question. Clearly, effective response to pandemic or outbreak are always challenged when there's instability. I think that is known. Instability will naturally fuel out disease outbreaks, and disease outbreaks will be poorly controlled in areas that are with instability or insecurity. A case control study here, this is a fascinating example. In DRC, it took us more than 2 years in North Kivu to control Ebola. And we were in that theater of response with the best tools that we've ever had with Ebola. We had monoclonal antibodies that work for treatment. We had vaccines, and we knew how to do contact tracing forever. But it took us more than 2 years to declare that outbreak over. So why was that? Because of the insecurity that was going on in that area. Clearly it became challenging. You all recall that healthcare workers were killed, including the senior WHO staff. Then you go to West. If you all now recall that immediately after that outbreak was declared over, another Ebola outbreak was declared in Western Congo, in the Mbandaka region. And it has taken us less than 3 months to bring that outbreak under control, because using the same tools, the same approaches, within 3 months, very limited circulation. And so that is clearly a demonstration, that we have, as we say in science, evidence that crisis and instability will prolong our ability to fight any disease outbreak. And I think the situation that you just described will be very, very challenging to bring COVID under full control. Even if there were vaccines today, how do you vaccinate in an area that is not stable and secure?
Thank you. And Coletta has a similar question, but she's generalizing it a little bit more to the whole continent. And she says, how concerned is the Africa CDC that continuous conflicts on the continent and some new ones are dragging the continent back in the fight against the COVID-19 pandemic?
Thank you, Coletta. It's dragging us back into inability to fight other diseases. Remember that Africa is dealing with 2 pandemics. The HIV pandemic is still there, and the COVID pandemic, we don't know how the trajectory will look like. And Africa is dealing with what are called syndemics. That is a combination of 3 different health challenges. One is the existing endemic diseases / pandemics, the HIV, TB, malaria. The second is the COVID-19, the likes of COVID-19 and Ebola. And then the third is the non-communicable diseases. They all require a stable environment, a predictable environment for us to fight these diseases, which we all know are really the underpinning, the drivers of our own development. We've seen how damaging COVID can be to our economies. So I think any instability that is recorded across the continent will continue to provide an avenue for us to be challenged to not fight those disease outbreaks, be they the endemic diseases or new outbreaks or the non-communicable diseases.
Thank you. We have 2 questions from Peter Mwai from the BBC, and Ahmed will take the first one. Looking at where new cases are rising on the continent, the bulk of the cases appear to be from North African countries and from Kenya, and to some extent, South Africa. What would you say is behind this?
Thank you, Peter. Second waves are essentially a manifestation of continued community transmission of the virus. Where people begin to interact more, the virus is then transmitted more within a community. Secondly is the implementation and respect of the public health measures that we know work so well. If a community keeps the public health measures being implemented, then the numbers remain low. If these public health measures are not being implemented, then a transmission will also increase. So when we look at the amount of information and knowledge that we have today compared with when the pandemic started, we really should be seeing a better response, not just from those who are charged with the responsibility of providing guidance like governments, ourselves, WHO, etc., but also from members of the public. We know that masks work. We should wear these masks when we are in the public. We know that washing hands work. We should be washing our hands and keeping our distance. This is the way to keep the numbers lower and therefore limit transmission within the population. It is a vicious cycle when the numbers become more, then transmission also increases. And that is partly why you see countries going into, even if it is partial limitation of movement, also being contained within smaller areas. If we keep to the public health measures, we test to identify who is affected and contain, the spread lower. We will not go into another wave in the future.
Thank you. Dr. John, there is a second question from Peter. And that question is, we have been seeing the rate of testing in African countries going down. The fact are countries still struggling with capacity and testing strategies?
So, as a continent, as I indicated earlier, we continue to make progress for sure. And if you categorize, and we'll be happy to share that with you, I think a vast majority of countries are now doing what the WHO has recommended of 10 tests per case. I think really, which was I'm very encouraged with that. And so that is where we should be, what we should be looking at. How many countries are doing that? Number, a large number of countries. I think there were 16 of them. I mean, I'll be happy to send you the slide that analyzes that are still performing less than 10 tests per case. We are really called on the political leadership of our continent to continue to support these public health measures. The only way that you bring the economy back is by implementing the public health measures, which starts with the testing. Again, the 3 T's: the test, the trace, and the treat. So, and lastly is that the antigen testing is becoming available. We are shipping them out rapidly. As I indicated, we've shipped out about 2.7 million tests already, rapid antigen tests, and we all called on the political leadership to maintain the momentum that they started this fight with.
Thank you. I'll come back quickly to Ahmed because you've already answered this question, but I'm just wondering if you have any other comment. And this question is coming from Elizabeth Merab from the Nation Media in Kenya. And Elizabeth says countries like Kenya fared well during the first wave, but are now recording high death rates as well as cases. Is this a cause for worry? And are there things that such countries can do to overcome the surge? I know you've already spoken about the need to adhere to public health protocols, but very briefly, I don't know if you have further comment on this issue.
I would only add the angle of the death rates. When we look at the case fatality rate, it is about 2.4% on the continent now. So the higher the numbers of those who have been infected, then you will expect that the numbers of those who need critical care and those who will then lose their lives as a result of the virus will also increase, precisely because we do not yet have a definitive treatment for coronavirus. So it is extremely important to keep those numbers low so as to protect the most vulnerable in the community. So keeping numbers low is really, really essential to ensuring that even when we are going into experiencing the second wave, if we keep the numbers low, then we'll keep the deaths low as well. But the essential part will still remain the public health measures, and really the government needs to be pushing this even more within the public so they understand and appreciate the need to keep those public health measures the essential response at the individual as well as the country level.
Thank you very much for that. We are beyond our time that's located for our briefing, but the producer has given us a further 10 minutes to have the remaining questions. So let me come back to John, and this question is coming from Bonisile Makubu from the Times of Eswatini, and she has 2 questions. How much are countries expected to contribute towards the purchase of the vaccines? I think this is in terms of dollars and cents and perhaps other resources. And secondly, can those countries that can afford go beyond the 60% target in vaccinating their populations? So that's from Bonisile from Eswatini.
Absolutely. I think let me start with the second question. I mean, if that is what we are recommending based on the science, and I've explained some of the science behind it during this conversation. And of course, countries can go beyond that. My really concern is that that once the developed world vaccinate the population, there will be a requirement for a COVID vaccine certificate to be issued for travel. And that means it goes beyond just public health measures, but that it becomes a requirement to ensure that the safety. We've already heard from the Qantas, this is the Australia certificates, and we, as I said earlier, we heard from China calling on a vaccine code to travel. So the point I'm making is that if countries have the means to vaccinate their entire populations or more than that, I think it's really we are not against that. I think we actually encourage that. Where is the money coming from? I did explain that there are 3 pots of money, and countries are also, so countries that are joining the COVAX facility, some will pay and some will be subsidized. But remember that the COVAX is only saying they will provide you up to about 20% of vaccination of the continent, and it will be prioritized to target and will target the frontline workers, those with underlying diseases and those with the elderly. That doesn't take you to 60%, and that is not going to allow you get the herd immunity. The worst thing we want to do for the continent is to allow COVID-19 to become an endemic disease where it sees itself in a remote area in Kenya and then start affecting people there or killing people there. Then we are scrambling and like polio. I think then we'll live with it forever. So that's why our target of 60% makes sense. We don't know yet, given that this is a new virus, that we may need to adjust it higher or we may need to adjust it lower, but the key thing is that is based on the facts and science. That is the level of vaccination that would at least attempt, and based on the efficacy of the vaccine, that will allow us to get to that 60% herd immunity.
Thank you very much. Still talking about the 60%. We have a question from Della Russell, and this is her second question. And she's saying, what will be the criteria for the 60% vaccination program? Will priority be given to countries with financial vulnerabilities, or will it be a case of increased case count is the one that will be determining?
So there's on the 14th and 15th of December, we will be hosting a large consultation to discuss what we call fair allocation and equity distribution of COVID vaccines. And we'll actually do a very deep dive analysis of who gets it first and when do they get it. So it's clear that we are completely aligned with COVAX, which says that we should priority population, regardless of the money. So let's remove money from the table. Should be healthcare workers, should be those with underlying diseases, should be those who are the elderly. Now, we know that many of our young people are infected, or the young people that are infected are not asymptomatic. But it doesn't mean they are not transmitting. They transmit, but they are asymptomatic. You can see where the dilemma comes in. So how do we vaccinate those people so that they do not become a reservoir of transmitting the virus? So if someone is infected and they are running around doing their things, they are not sick, and they will be transmitting the virus for sure. They will take the virus home and transmit the virus to the elderly or the vulnerable there. So we have to look at that and see. After we've vaccinated the first category of people, who are the next category, and only through a continental consultation in the way we are going to organize it on the 14th and 15th that we'll get to do. An analysis, a similar reflection that took place in the United States, and this was led by the National Academy of Science. And so, I mean, if you read that report, you'll be surprised to see that other populations, like those incarcerated, were also a priority population, because these are people who live in masses. We may, after a consultation, we may come out with one of the target group being vaccinating populations that live in clusters. I mean, like in some of the populations there. So I don't want to sit here and start mapping out a strategy of how the continent should be vaccinated, but we would like it to be a really consultative approach, and we have those answers beginning 14 and 15 of December.
Thank you for that. I think we'll take our last question, and this one is from Peter van Heusden, writing from South Africa. And Peter says, congratulations on your leadership, Dr. Nkengasong. Do you think that people in countries with second wave dynamics like South Africa should stay home and cancel family visits, etc., for Christmas?
I think that is a very good question, Peter. There's I wanted this briefing with what I call safe holiday seasons, and how season safely. A tough year, and we are social beings, and as social beings, we don't want to solve this problem in a way that do not create other problems like mental health and stay connected with their families. I think there are 5 things that I would recommend for as we prepare for a safe holiday season. One is do more outdoor activities as much as possible. That is, the more stay indoors in clusters, the more we offer an opportunity for the virus to spread. I mean, it's known. I mean, from what we say, we don't do massive gathering of activities. I mean, we should be very, very clear. Even if the rate of positivity is less than 5%, if we start gathering in large numbers for celebration, we offer an opportunity for the virus to spread. The third is really what I call family masking. And it's not because you are in a family that the virus respects the family. This virus doesn't respect the family. It will run into a family and do whatever it needs to do. So if in families where we are socializing and providing that outdoor gathering there, we still mask. I think that is, and encourage each other. This is very important, because we may have a false sense that because we are in a family of 10 sitting there and we go a desperate way to leave the out and shop and you come back, you may have been exposed. Back to so really that's it fun that we sit around the Christmas table and create jokes around my mask and your mask and whatever. They will be denying the virus the opportunity to spread. And the hand washing has to really be maintained during the Christmas. And lastly, we have to go out there and buy gifts to loved ones, but go out with a mask, go out with a small sanitizer because you don't know that article in the shop that you are touching, who touched it previously. And you may just inadvertently touch your eyes, and then you touch your mask. And it's really to be very deliberate and do these 5 things consistently all the time. I think we'll come back to that as we get closer to the end of year holiday seasons.
Very good advice there as we are coming to the festive season. Now we have come to the section where we get your final comments, and let me start with Ahmed. If there are any really important points that you want people to remember from the messages that you've sent out this morning.
Thank you. And only 2 things. One is it is our actions that actually spread the virus. The virus will not spread.
We can hear him.
How you beyond that. So it is your actions and your source of information that is going to guide correct action in the community.
Our actions are important. Thank you very much for that final concluding remark. We come now to Dr. John for your final comments.
So my final comments would permit me to focus on vaccines, because it is going to dominate the news in the coming days, and it is already dominating the news. I think there are really three things I'd like to all of us with. One is that we have to use the whole of society approach in advancing vaccination on the continent, which means that we all hold ourselves accountable in spreading the right information, that these vaccines are safe, these vaccines are effective, and we give no room for anti-vaccine movement to install. The greatest defeat that we will have is if we have vaccines and then our population do not take the vaccines, and then this virus seeds itself there for the long haul. The second message is really that we are striving as a continent, as the whole of Africa approach, which is a strategy endorsed by the head of states, chaired by President Ramaphosa in his capacity as the chair of the African Union, to get to 60% vaccination. This is in science. We are not pulling the numbers from mid-air. And we really have to be seen like that we failed in trying to get to 60%. Will not judge us fairly if we do not try to get to 60% to get herd immunity. Then my last message is that we have to have a global dialogue now, where we all agreed on the modality of whether we need a vaccine certificate to travel or not. What would be extremely dangerous is that people vaccinate themselves first, and then they impose conditions on who comes in or who goes out there. So that conversation will need to take place upfront, so that we are on the same page of understanding with respect to whether we need a vaccine to travel, a certificate to travel or not travel, because that will change the dynamics of what we do, how we approach a vaccine access or lack of access to it. So I would like to conclude with those three messages for today.
Thank you very much to both Dr. Ahmed Ogwell, the Deputy Director of the Africa CDC, and Dr. John Nkengasong, the Director of the Africa CDC. Well, colleagues, that brings our press conference for today to an end. It's been a really busy one, and we've had a lot of questions on many, many different issues, and we thank you very much for that continued interest in joining us for these briefings. We will be back with you again next week on Thursday at 11 a.m. time in East Africa. So for now, have a great week, and we'll meet next week.
I will just conclude that, just to know that the next briefing will be live from DRC, from Kinshasa, which I will be there doing the same thing that Dr. Ahmed is doing from Kenya. So we'll give you on the ground live information from DRC next week.
Wonderful. Thank you very much, Dr. John, therefore, coming in and showing that the leadership of the Africa CDC is going to countries physically, because at this point, it is really important for us to continue engaging as Africa has entered the second wave of the pandemic. So we'll talk to you next week at 11 a.m. East African time with Dr. John Nkengasong from the DRC. Bye-bye for now.